Welcome to the Explainer. If you've spent, literally any time online lately, you've probably been targeted by this massive internet trend of vagus nerve hacks. From TikTok to wellness blogs, everybody is talking about resetting their nervous system. But today, we're going to unpack this whole phenomenon and see exactly what happens when viral biology hacks collide with actual, real-world clinical science. So let's just dive right in.
So, can a simple nerve reset cure everything? It's a pretty provocative question, right? I mean, influencers are making absolutely wild promises these days. They're claiming that by simply looking sideways, maybe humming a bit, or rubbing your neck, you can overcome chronic anxiety, radically improve your memory, and even increase your overall success in life. They basically frame it as this magical on-switch for human optimization.
And honestly, that just brilliantly illustrates the sheer absurdity of all this hype. The McGill University Office for Science and Society points out how this nerve has been elevated to an almost mythical status online. And, spoiler alert, it's incredibly profitable. Because if you don't have time to do those viral eye movement exercises, well, the wellness industry is more than happy to sell you a $65 Goop Vagus massage oil to rub on your neck. But we really need to separate the clever marketing from the actual medicine here. On one side, we have the internet promising these instant anxiety cures through DIY eye movements. And then on the other side, we have the clinical reality, where medical professionals are using highly advanced therapies to treat incredibly complex conditions, things like treatment-refractory epilepsy and severe depression. The gap between these two worlds is just massive. All right, moving into section 1, Anatomy of the Wanderer, inside the vagus nerve. To understand why that massive gap exists, we have to look at the actual biology. First off, we call it a nerve, singular, but actually it's a pair of nerves. You've got one on the left and one on the right. It's the 10th cranial nerve, and it's the longest cranial nerve we have. The word vagus literally means wandering in Latin. It descends right from the brain and acts as our sort of unconscious inner brain. It's the primary gateway to your parasympathetic nervous system, which is the system responsible for resting and digesting. And they weren't kidding about the name. It truly wanders. It splits and branches out, tapping directly into your heart, lungs, spleen, liver, diaphragm, and your intestines. So the key takeaway here is that it truly is an essential biological superhighway. It is constantly communicating visceral, somatic, and immune signals back up to the brain, essentially answering the brain's constant, vital question, hey, is everything okay down there? Okay, section 2. Clinical science versus hype, the real interventions. Now that we know what it is, let's look at how medical science has legitimately utilized this superhighway, long before wellness influencers ever discovered it. Medical science actually has a surprisingly long history here. Way back in the 1800s, neurologist Dr. James Corning literally used an electrified Y-shaped fork on the neck to try and treat epilepsy. Fast forward a bit to 1997, and the FDA approved surgically implanted chest stimulators that wrap around the left vagus nerve to manage epilepsy that wasn't responding to other treatments. And today, we actually have non-invasive transcutaneous stimulators. These are devices that look kind of like smartphones or tasers, and they're cleared for things like headaches and PTSD. Let's look at exactly how complex this real science gets. What you're seeing here is a real clinical device used in a small-scale study by researcher Pascal Gerlau. It's called transcutaneous vagus nerve stimulation, or TVNS for short. It uses these highly specific ear clip electrodes that plug right into the concha area of the ear. They do that to target the dense network of vagal fibers there, attempting to treat chronic disorders. What's absolutely fascinating here is the sheer precision required. In the study, they couldn't just blindly stimulate the nerve and hope for the best. No, they had to target different conditions using highly specific electrical frequencies and pulse widths. For instance, generalized anxiety required 20 Hz at an 80 microsecond pulse width. IBS needed a low frequency of 3 Hz. This brilliantly illustrates that actual, real-world vagus stimulation is incredibly complex and totally condition-specific. Which brings us to section 3, why the claims fail, the boogeyman myth. So, what actually happens when we put this precise, complex science to the test? Well, here is the huge twist found in the data from that TVNS study. Despite using highly specific medical equipment, exact frequencies, and precise pulse widths, this small-scale study completely failed to demonstrate statistically significant clinical improvements for these patients, especially for chronic pain. I mean, sure, there were some minor trend improvements for anxiety and IBS, but nothing statistically concrete. Turns out, real science is hard. And that brings us to what McGill University perfectly calls the boogeyman and panacea myth. See, wellness influencers crave black and white simplicity. They frame the vagus nerve as the boogeyman that's causing all your problems, and simultaneously the panacea that will cure them all. But as we just saw with the ear clip study, real science is absolutely tortured with nuance. Clinical trials constantly struggle with complex parameters and stubborn biology, while influencers just, tell you to rub your neck. Let's do a little jargon strip right now to see how this works in practice. When an influencer online tells you they are teaching you how to perform a polyvagal reset, the scientific reality is that they are literally just telling you to take a deep breath. That's it. They take a simple, highly effective concept like relaxation, and they dress it up in pseudoscientific language to make it sound super cutting edge. All right, on to Section 4, The Truth About Breathing, Biology of Relaxation. Here is the genuinely good news. Let's pull back the curtain on the one DIY hack that actually does have strong biological backing. You've probably seen this technique around before. It's called box breathing, famously used by Navy SEALs for stress relief in high-pressure situations. You inhale for 4 seconds, hold for 4, exhale for 4, and hold for 4. It's basically a practical way to control your respiratory function, which directly communicates a sense of safety to your nervous system. But if you want to optimize that even further, keep the number 6 in mind. Both the Cleveland Clinic and experts like Dr. Pradeep Jamnadas emphasize that the real key to lowering your heart rate is actually the exhale. Inhaling for 4 seconds is great, but exhaling for 6 seconds, or even up to 10 seconds if you can, is what truly tells your vagus nerve that you're not in any danger. That prolonged expiration is the real biological trigger here. And the reason these specific breathing techniques actually work is because they improve your heart rate variability, or HRV. This is the micro variation in the time between your heartbeats. A higher HRV means your body is highly adaptable to stress. Box breathing and those prolonged exhales stimulate the vagus nerve, which increases your HRV, lowers your cortisol, and shifts your body completely out of that sympathetic fight or flight mode right into the parasympathetic rest and digest state. So, what is the big takeaway from all of this? Well, McGill University summarizes it perfectly. The vagus nerve trappings we see online are really just scientific dressing. The weird eye movements, the super expensive massage oils, it's all just marketing meant to transform the absolute common sense of basic relaxation into a highly marketable, cutting-edge body hack. Which leaves us with the final, pretty provocative thought to consider today. With our modern wellness culture's absolute obsession with complex jargon and expensive quick fixes, are we actually biohacking our nervous system, or are we literally just paying people to remind us to stop and take a deep breath? The desire to reduce stress is incredibly valid, for sure, but sometimes the simplest, most biologically sound answer is entirely free. Thanks so much for joining us for this explainer, and I'll catch you on the next one.